Good afternoon. This is Dr. Bobby Cawthron, lead veterinarian with Aspen Veterinary Care, coming to you from Fort Collins, Colorado. Today we're going to talk about seizures, and seizures in our pets specifically. Seizures are a really unfortunate disorder that's very dramatic for our pet owners and can be something that is a lifelong treatment and a lifelong concern. We're going to start with, what is a seizure? Well, a seizure is basically defined as a misfiring of all the electrical activity that's going on in the upper part of the brain. So the cerebrum of the brain starts misfiring and it goes into almost a storm of electrical activity, which then results in what you see clinically, which is a pet that no longer has control over its body. So the classic seizure presents with a pet that generally falls to one side and goes through a tonic-clonic convulsive state. The whole body is involved, and several things can happen at that point. They usually go into that state for several minutes with a lot of muscular activity, a lot of paddling, sometimes an outstretched neck and arms, and then they will also sometimes lose their bowels, their urine, things like that. As you can imagine, this is a big deal if a pet owner comes across a pet and has this happen to them, especially the very first time. That's what we call generalized seizures, so the whole body is involved. We can sometimes also have just partial seizures, and those are a little bit more bizarre. You can get just a head shake, an arm just moving, something like that happens, and that's still a misfiring that's going on. It's just not necessarily affecting the whole body. So what is causing this to happen? Well, there are cases of what we call epilepsy. And epilepsy is really just defined as there's no reason for it. So it's an idiopathic seizure disorder. We can't find anything creating this problem for us. It's just genetically predisposed. And your pet is going to have this, if they get this diagnosis, they're going to have this for the rest of their life. There's this others, and it's a huge broad spectrum of different disorders that can cause it. Anything from stuff in the brain causing the problems, inflammation, infection, tumors, absolutely can create seizures. But you can have extracranial problems too, where the body is starting to go into some disease, and seizures are just a symptom of that. And that includes kidney problems, liver problems, various other conditions, hypoglycemia. All of these are based in this other type of thing. And we a lot of times come to this conclusion based upon doing good diagnostics to figure out where this might be coming from, but also we base it upon age. So we get a puppy that starts to have seizures, we start thinking about hypoglycemia a little bit more because they can't control that as well. We get a very older patient that just starts to have seizures. Unfortunately, we worry about things like tumors in their brain that could be causing this. For a lot of our kind of middle-aged patients, 1 to 5 years of age, epilepsy is going to be your most common diagnosis. You still want to go through those diagnostics and make sure we don't have something else going on. But once we kind of clear the slate of those problems, you have that definition of epilepsy. What do we do after that point? Well, a lot of times we want to help those pets out. We have a few rules that we live by. One of them is, if the seizure is fairly light, it only lasts for a couple of minutes, and they're not happening very often, we don't do anything. We absolutely want the pet to have a good quality of life, and sometimes adding chronic medications may not be the best thing. Now, if they only have seizures every couple of months, we won't mess with them too much. If they start having seizures often enough, and my rule is more than once a month that a pet owner is seeing a seizure, or they're clustering seizures, which is more than 2 in a 24-hour period, we want to control that. And controlling that usually does mean long-term medication. And there's several anti-seizure medicines that are out there on the market. Some of them have certain side effects. Others, are very easy. It just depends on the pet, the breed, and what we feel might be best for them in their particular situation. We'll also bring up the subject of a really important emergency situation when it comes to seizure activity. Seizure activity is really a benign process that's happening in the body in the sense that it doesn't hurt anything. They, of course, in the physical activity of having the convulsions can maybe injure themselves, but it's not physically harming the brain or the other organ systems unless their seizure starts lasting a long time. We get into that 10+ minutes of tonic-clonic convulsive state. we get so much muscular activity that we literally start raising our body temperatures well above normal to a point that we start breaking down proteins and enzymes, and that can be life-threatening. That state is called status epilepticus, and it means it's just a seizure that doesn't stop. And we have to be very, very aggressive in getting that under control. And that can be a true emergency situation where you need to get somewhere as soon as possible and get that stopped as soon as possible. But for most pets, it is an activity that is not too harmful. If they come out of the seizure activity within a couple of minutes, they're usually up and acting pretty normal. They might be a little tired and a little disoriented in the very beginning, but they usually are quite normal before and after those activities that are going on. So this is a big kind of subject that takes a lot of effort to kind of sort through. This is a little bit that we wanted to talk about to get some information out there. This is definitely something, if you see in your pet, you need to talk to your veterinarian, make that appointment, and find out what you can do to help them out. For more information about this topic, you're more than welcome to visit our website and our blog that's located there.